EI sees families as really important. They've got a huge role to play with someone who's experiencing psychosis, and we recognise that. So we offer a research evidence-based family intervention, and that's working with a family. Can be everybody within the family is included in that, including younger siblings to older siblings. It's very kind of informal in one respect, so we call them family meetings, and we can meet in the home. And we talk through, you know, what the problems are. It could be problem solving, communication. It could be the helpful way we do things with people with psychosis, and it could also be the unhelpful ways, and it's just addressing it with the family in terms of how they see what the problem might be. So it's got a lot of success rate working with families, and it's really important, and it has a huge influence on the way that someone with psychosis might recover in a positive way. Because if everyone's feeling supported in the family and everyone's kind of having that support, then yeah, it can have a huge influence on how everyone feels and feel more confident and have a bigger understanding about the idea of what psychosis is. So we've got groups, we've got one-to-ones, we've got care coordinator roles, and it fits in nicely with families, because we value families and they're hugely important for that person who's experiencing psychosis. So if family members don't want to be involved in early intervention, then that's fine. And I guess as long as we've explored those reasons why, then they don't have to partake. It's not about forcing anybody to be part of the meetings. It's very much on who wants to be there and who wants to help. And it could be that maybe that person might benefit from a more one-to-one through carer support, looking at, you know, the stresses around, you know, there could be difficulties within the relationships, and it's about supporting the whole process, so nobody's forced to join in the family meetings. But it's also recognising that actually they do have a valuable role to play, so that could be explored through a different avenue. The evidence is very strongly for family intervention and shows that if the family are functioning with the support they're needed and creates an understanding, then actually there's a much better chance for that person to recover successfully. So families, as well as being part of the whole process, they very much have a dual role as carers as well. So we recognise carers as in their own right as carers, not just family members. So with that comes support. So we have people trained within the team that can work closely with carers, and that can be inside the home, outside the home. And it's about that carer having that time to offload, or it could be about supporting that carer with educational needs around the psychosis, greater further understanding. Yeah, and it's about communicating with that person. It's about them feeling listened to, feeling valued. It could be talking about creating an understanding about, you know, what's happening to them, what's happening to the person with psychosis. So it could be some like psychoeducation stuff. Sometimes it's just really helpful to listen to someone who's offloading, because they feel much better afterwards, and that's quite nice over a coffee and a biscuit. There's a huge lot of research out there that it shows that by supporting the family and the carer, for those people to be supported, it actually creates this huge support network for the person experiencing psychosis.